after medical school, I did a family practice residency program. And family practice is where you do everything. I delivered 200 babies. I saw children, adults, infants, all the way up to nursing home patients and everything in between. And I really enjoyed that. And while I was in residency, a man came in one time and he was having side effects from a medication. And the medication was for his cholesterol. And he wanted to know if there was anything else he can do. So I went and talked to the attending physician, and he said, well, just switch him to a different medication. Well, he wanted to know if there was any side effects to that, and I looked it up, and sure enough, it was the same side effect as the one he was on. So I thought, well, he said, isn't there anything else? And I started researching and looking at the fact that the medications really weren't beneficial. They weren't that good. In fact, the research showed that they could do more harm than good in many cases. And so I looked for alternatives, and I found something, gave it to him, and it worked. His pain went away, he felt better, he had more energy, and his cholesterol was lower. With that kind of result, I started looking into alternatives more and saying, you know, what really works instead of what do they tell me to give for this disease or that disease. Then I became the medical director of a nursing home. And when you're the medical director of a nursing home, you have to take in, I had to take in all of the worst cases, the ones that none of the other doctors would take. Some of the ones I had would be on 10 or 15 or even 20 medications. This long list of medications. And everybody knows that if you have over 6 prescription drugs, you're more likely to die from your drugs than you are from any disease they could possibly be treating. So I would call the rheumatologist and say, can we get off some of these? No, can't get off my drugs. And then I'd call the cardiologist. Can we get off of some of these? No, can't get off any of my drugs. You're gonna have to talk to somebody else. So nobody was willing to help me to pare down this polypharmacy, it's called. So I started researching it myself again. I started looking into what can I do instead of this one for osteoporosis. And it turned out there was something really good, really beneficial. You could use a plain vitamin and have more benefit without the side effects. Well, what could I do for this high blood pressure medication? And I started looking at things, and I would be able to pare down lists of medications from 15 or 20 down to 2 or 3 very often. And the benefits of that went far beyond just having fewer medications. These people, they felt better. They were able to get up out of bed and go in and eat in the cafeteria instead of having the food brought to them. They just did better, generally. So as I was doing this and getting really good at taking people off their medications, I incorporated that into my regular practice, where people would come in with diabetes, and I'd say, you know, you don't need this medicine. You can do this instead, and this instead, and this instead. And what would happen is people would have more energy. They'd come back and say, I feel better, I have more energy. And the blood sugar's still down. And you have these kinds of stories to tell, these kinds of miracles in people's lives. It really makes medicine worthwhile. It really makes being in healthcare just a joy. That's why I love life.